Hi lovely ladies, Dr. Heather here. Today I'm going to talk about one big secret to weight loss. Now, it is nearly impossible to lose weight if you have a blood sugar issue, and it's almost certain that if you have a weight issue and you struggle, that you have a blood sugar problem. So a lot of you out there have said, well, I don't have a blood sugar problem because they've tested my fasting glucose and it all looks good. So let's go through some of the symptoms, the signs and symptoms of you having a blood sugar issue, and then we'll talk about the labs in just a second. So essentially, if you can't lose weight, you likely have a blood sugar issue. If you get fatigued after meals, so after you eat, you get really tired, especially after lunch, that mid-afternoon slump. You start craving sugar after any kind of meal, or you have sugar cravings throughout the day. If you have abnormal menstrual cycles, that means PMS symptoms. That means your menstrual cycles are long or short. A lot of times that's caused by a blood sugar issue. And if you can't fall asleep and or stay asleep, a lot of times that will be a symptom of a blood sugar imbalance. So many times we miss our blood sugar imbalances because we're only looking at fasting glucose. Just yesterday, I did a patient's blood work and her fasting blood sugar was 85. And you'd think, well, that is pretty perfect. We're really looking to get blood sugar fasting 80 to 90. But as I'm looking through her blood work, her A1C was a 6.1. So she actually was in a pre-diabetic range for her A1C. So her 90-day average of blood sugar was elevated, but we're just not seeing it in that fasting glucose, right? So you're gonna miss a lot if the only thing you're looking at is fasting glucose. So here's some other markers that we use to understand if you're dealing with insulin resistance or any kind of blood sugar imbalance. So yes, fasting blood sugar is helpful, but it's only a small little piece of the puzzle. Your hemoglobin A1C is really important, but it's not the only thing either. High cholesterol and high triglycerides a lot of times are related to high blood sugar or blood sugar imbalances. High or increased testosterone levels. There's another marker, glycomark, which is really important. It tells me what your blood sugar variability is. Uric acid, LDH, insulin levels, liver enzymes, and cortisol. And not just running cortisol in the blood work, but also looking at cortisol in saliva and really graphing your whole circadian rhythm, or you can look at cortisol in the urine. So it's really important to look at hormones and in the urine and in the saliva as well, so that we can really get a full picture on what is going on. So you have to dig deep and you have to really figure out what is going on, because I am pretty sure that if you're dealing with stubborn weight and it will not come off, that you have some part of a blood sugar imbalance, and you have to dig deep and figure out where it is. Now, the other thing that I like to do is check fasting glucose, not just fasting, but check your glucose with a glucometer. They now make continuous glucometers so that you can understand how the food that you're eating, how the stress that you're dealing with is impacting and affecting your blood sugar. I was checking my blood sugar every 30 minutes so I could see how my body tolerated intermittent fasting. So you can get really crazy with this blood sugar thing, but for sure, if you're dealing with weight issues and you have any of those symptoms I listed before, you're likely dealing with an underlying blood sugar issue. And once it's resolved, you will see those symptoms start to go away.